Children in Eastern and Southern Africa have been very badly affected by HIV. An estimated 1.3 million children there under the age of 14 have the virus, and over 8 million children have lost one or both parents due to AIDS. The prevalence rate amongst adults in the region is estimated at 7.8%, the highest in the world. David Alnwick is UNICEF's HIV advisor in Eastern and Southern Africa. He's here to talk about why prevalence rates in the region are so high, and what UNICEF is doing to support children affected by HIV and to prevent new infections. Firstly, could you explain why this region has been affected so severely by HIV?
I think the understanding is improving recently. People talk about a perfect storm, a coming together of several different factors. Each of those factors is common in other parts of the world, but all 3 or 4 factors coming together is a situation in Southern Africa and some parts of Eastern Africa. Some of those factors include a lack of male circumcision. In the highest HIV prevalence countries in Southern Africa, very few men are circumcised. The new evidence shows conclusively that a man's risk of HIV infection is reduced by about 60% if he is circumcised. So the lack of male circumcision is one of those factors. The second is the fact that many people in Southern Africa have multiple and overlapping sexual partnerships, which facilitates the rapid transmission of the virus from person to person. In other parts of the world, serial sexual partnerships are common. People, unfortunately, perhaps are not faithful to each other in many parts of the world, but it seems to be much more dangerous if a partnership is concurrent, and that seems to be a very key driver. The other factor is that there is a very high prevalence of HIV in Southern Africa, which makes any sexual encounter much more risky than anywhere else in the world, and the factors by which that shot up in the 1980s and early 1990s are somewhat different, and partly linked to the history of apartheid and labour migration in South Africa. That undoubtedly had a contribution in sort of getting to a very high rate, and then these other factors keep it going. Scientists continue to discuss whether there are also underlying genetic differences or genetic factors making people more susceptible, making young women more susceptible. That data isn't really out there yet on that.
And what impact does this high prevalence rate have on children?
HIV in Southern Africa, and to a lesser extent in Eastern Africa, is a major impediment to child health and child survival. In some countries, some 30% of under 5 mortality is directly attributable to HIV infection. Fortunately, we are seeing a success in PMTCT programs, the prevention of mother-to-child transmission. That is catching on. Some countries have got 80% of all pregnant women now get screened for HIV, and if they're infected, get access to treatment. So there are good benefits there. There are huge numbers of orphans due to their parents dying of AIDS, but again, there is light on the horizon that as treatment access rolls out, and many countries in Southern Africa now do have access to ARV treatment, there is no reason for a parent today to die of HIV. Antiretroviral treatment should be available, and I think UNICEF is advocating and will continue to advocate that we should do more to try and ensure that all parents know their HIV status, and if they are infected, they access treatment not only for their own health, but to ensure that their child doesn't become an orphan. Orphan prevention, I think, is the big challenge today.
And what sort of work is UNICEF doing around the prevention of new infections? I
think we in UNICEF are taking a very hard and critical look at what we have been doing in the past, asking ourselves as to whether past approaches have been as effective as we would have hoped they would have been, and asking ourselves what we should be doing differently in the future. In the past, we focused a lot on providing basic facts and knowledge as part of life skills to very young people in primary schools. That has been useful. We're not abandoning that, but we do feel that now is a sort of foundation program that more and more governments should take on the responsibility of doing, and that perhaps UNICEF should look at some of the more newer and more challenging areas of perhaps working with young people who are more directly at risk of acquiring HIV infection, young adults about to embark on the beginning of their sexual careers, and trying to ensure that they have the best possible information on risk and prevention. and also working with entire communities, not just sort of focusing on young people themselves knowing the risk factors and how to prevent HIV, but ensuring whole communities know what is placing them at such risk. UNICEF works within the UN system in close partnership with UNFPA and UNAIDS. We have been, with those partners and governments, looking at modes of transmission, looking at the latest data on just who is infected and getting affected by HIV, what the major risk factors are, and working with governments to sort of redefine prevention, to try and make sure that we are focusing on the most important things, not just on what we've been doing already. I talked earlier about male circumcision, and the United Nations agencies, together with other donors, and UNICEF is involved in this, together with WHO and UNAIDS, is supporting national governments to look very carefully at the data, to design plans about how they might increase the availability of male circumcision. And that is, in fact, quite feasible and quite popular in a number of countries in southern Africa, so that's an additional approach. And we are working with other partners and both within the United Nations system on ways of reducing this problem of multiple concurrent partnerships that I talked about earlier.
Looking at some specific country examples, could you talk about some of the prevention projects run by UNICEF which have proved successful in reducing the number of new infections among young people?
Unfortunately, the nature of HIV risk is such that it's unlikely that we will ever have a single sort of factor, single program that we can be absolutely sure has contributed to a reduction in risk from A to B. There are some very promising signs in the region. We can talk of the what is called a stepping stones approach, which provides repeated and intensive up-to-date information to sexually active young people in southern Africa. A recent evaluation in South Africa that showed some very optimistic signs that may have been working. We can point to examples in Kenya, for example, where one of the major risk factors in one part of Kenya was identified to be what are called age-disparate relationships, young women having sex with men who are very much older than themselves, which actually placed them at a great risk of HIV. The women themselves didn't know that they were at such a risk, and providing that information in a responsive sort of way, locally based, seemed to be quite effective, and knowledge change and probably reported behaviour will change. There have been some very innovative communication programs in Swaziland to try and reduce the incidence of multiple concurrent partnerships, particularly with young people, and there are campaigns that UNICEF has been associated with, but they're largely implemented by other agencies, underway at the moment in South Africa, Lesotho, Zambia, to try and reduce multiple concurrent partnerships. Ultimately, it's going to be the coming together of basic good information on HIV prevention, the availability of male circumcision, increasing male circumcision programs, and intensive efforts on reducing multiple concurrent partnerships and age-disparate sex, together with empowerment of women and improved knowledge of communities and everybody, which will make a difference to HIV. We're seeing some optimistic signs, but if we continue on with these programs, intensify these programs, I think we're going to have much greater success in the future.
For more information about UNICEF's campaign to bring about lasting change for children affected by HIV and AIDS, visit www.unicef.org.uk/unite. This is Mary Whittaker, reporting for UNICEF UK.